Welcome to AfroNurse Academy, where we turn complex nursing courses into clear, simple lessons. This is the official breakdown of the NMC course curriculum. Whether you're preparing for licensure exams, facing semester tests, or just trying to understand what's ahead, knowing your roadmap is the first step to success. Quick tip before we start. If you're on a smartphone or tablet, flip to landscape mode. You'll see the course outlines, diagrams, and visuals much better that way. What you're about to see is the standard official curriculum approved by the Nursing and Midwifery Council. This is exactly what you need to master. Nothing extra, nothing missing. Now, looking at this outline, you might be thinking, that's a lot. And you're right. But here's where AfroNurse Academy is different. We're going to teach every single topic on this list, line by line, subject by subject. We'll break down each concept into simple, practical lectures that actually make sense. No confusing jargon, no information overload, just clear teaching that sticks. You don't have to figure this out alone. We've got you. So here's what you need to do right now. Hit that subscribe button, then tap the notification bell, because when we drop the next lecture in this series, you want to be the first to know. Grab your notebook, get comfortable, and let's master this course together. Your first real lecture starts now. Let's go.
Let's talk about FED 121, First Aid, Emergency and Disaster Management. This is a 3-credit course, and I'm not going to sugarcoat it. This might be one of the most important courses you'll take in your entire nursing program. Why? Because emergencies don't wait for you to be ready. They just happen. This course is split into theory and a lot of practical work, because when someone's life is on the line, you need muscle memory, not just textbook knowledge. We're preparing you to recognize emergencies fast and respond with confidence, whether you're in a hospital ward, at home, or just walking down the street. So what's the main goal here? Simple. You're going to learn how to save lives before the doctor arrives, before the ambulance gets there, or when you're the only trained person in the room.
We'll also tackle the psychological processes, how people learn, remember, and perceive the world around them. This is crucial when you're teaching patients about their medications or helping families understand care instructions. And here's where it gets really practical. We're covering motivation, intelligence, attitudes, and something every nurse needs to master: stress management. Because let's be real, nursing can be stressful, and your patients are often dealing with their own stress, conflict, and frustration. By the end of this course, you'll have the psychological toolkit to not just treat conditions, but to truly care for people. You'll understand the teacher-learner relationship, which is massive when you're doing health education. You'll recognize stresses and know how to help your patients cope. This isn't just theory for exams. This is your foundation for becoming the kind of nurse who truly makes a difference. So let's get into it. Now, emergency nursing, this is where we level up. You're learning CPR, how to manage a cardiac arrest, handle strokes, severe asthma attacks, acute abdominal emergencies, sickle cell crises, medication reactions, and even behavioral emergencies like attempted suicide or aggression. These are high-stakes situations that require quick thinking and steady hands. And finally, disaster management. We're talking mass casualties, road accidents with multiple victims, earthquakes, floods, fires. When disaster strikes and there are more patients than resources, you need to know how to triage, prioritize, and coordinate care effectively. Look, emergencies are chaotic. People are panicking, time is running out, and everyone's looking at you to do something. This course makes sure that when that moment comes, you don't freeze, you act, you save lives.
So buckle up